China, overwhelmed by mystery new virus outbreak 5 years on from COVID. Parents seen holding sick children amid long queues in pediatric hospital units. A mysterious viral outbreak is overwhelming some hospitals in China and prompting people to wear face masks again. Videos on social media appear to show medical units struggling with large numbers of patients. Parents were seen holding sick children amid long queues in pediatric care late at night. Many are drawing similarities with the early dark days of the COVID pandemic 5 years ago from its start in the city of Wuhan. According to local news reports, a little-known virus called human metapneumovirus, HMPV, has been blamed. It normally causes a mild cold-like illness, including fever, a cough, runny nose and wheezing. In severe cases, HMPV can lead to bronchitis or pneumonia, particularly in children. The virus spreads through respiratory droplets and close physical contact, making it highly contagious in crowded settings. The World Health Organization highlighted the increase in cases in a November bulletin, noting that respiratory infections had been on the rise since October. In response, China's National Disease Control and Prevention Administration launched a pilot monitoring system aimed at identifying and managing pneumonia of an unknown origin. This initiative is designed to improve tracking and response to the surge in winter-related respiratory infections. Although social media is filled with claims of overcrowded hospitals, no official reports suggest that the situation is critical. However, the NCDPA acknowledged a notable rise in respiratory infections between December 16 and 22. The ongoing pneumonia outbreak is particularly concerning for vulnerable groups, including young children and the elderly. Meanwhile, WHO has urged China to share data on the origins of the global COVID-19 outbreak in 2020, which led to an estimated 7 million deaths. Viral disease HMPV is on the rise among kids in China. What is it? Health officials have reported a rise in human metapneumovirus HMPV infections among children ages 14 and under in China, but the exact magnitude of this uptick is unclear. A viral infection called human metapneumovirus HMPV is on the rise among children in China, according to Chinese state media. The virus can cause upper respiratory tract infections, like colds, as well as serious lung infections. And according to state media, it's now one of the top 4 most common viral infections among hospital visitors in China. HMPV has been recognized as a significant problem in the at-risk population across the world since the turn of the century when it was first discovered. Andrew Easton, a virology professor at the University of Warwick in the UK, who studies pneumoviruses, told Live Science in an email. That risk has not changed significantly over the last almost 25 years. That said, it is always concerning to see a change in the incidence or pattern of an infection, Easton added. It's important to investigate potential surges in infection to pinpoint their cause. What is HMPV? HMPV belongs to the same family of viruses as respiratory syncytial virus, RSV, a seasonal virus that also causes colds and lung infections. HMPV was discovered in 2001 and, according to the U.S. Centers for Disease Control and Prevention, CDC, epidemiologist Eileen Schneider, the virus is associated with approximately 20,000 hospitalizations among children under 5 in the U.S. every year. Common symptoms of the infection include cough, fever, a blocked nose, and shortness of breath. However, these can progress to bronchitis, inflammation of the air tube leading to the lungs, or pneumonia, where the lungs' air sacs fill with fluid. Young children, the elderly, and those with compromised immune systems are most vulnerable to severe symptoms, according to the CDC. Should other countries be worried about HMPV in China? HMPV is a serious concern, especially for very young infants in the first year of life, Easton said. This is also true of RSV, as well as seasonal influenza, or the flu. However, he added that the risk posed by HMPV has not significantly changed since its discovery in the early 2000s. In a statement released December 27th, Can Biao, the head of the China CDC's National Institute for Communicable Disease Control and Prevention, announced that the rate of HMPV among children ages 14 and under was on the rise in China, according to China Daily. This rise in cases was also reported by Reuters. However, the scale and cause of the uptick are still unclear. It is important to be able to detect changes in patterns of infection and to then identify what the potential causes are. Easton said. We must assess whether it is a change in a behavior of the infected people that has led to increased exposure, or whether it is a change in the virus that has led to increased numbers of infected individuals. It's unlikely that mutations or genetic changes to the HMPV virus are the culprit behind the reported rise in infections, he said, but additional testing of the virus's genetic code is required to rule out this possibility. Meanwhile, China Daily noted that the overall spread of respiratory infections in China this winter has been lower than in recent years. Live Science has reached out to officials and scientists in China for comment on the situation, but had not heard back at the time of publication. How can we protect ourselves from HMPV? There are no available vaccines against HMPV. Additionally, according to the US CDC, there are no specific antiviral treatments for the virus. Rather, treatment for HMPV is supportive, meaning it aims to reduce symptoms and keep vital signs stable. According to the CDC, the infection duration is variable between individuals, but similar to other respiratory infections, including the common cold. To prevent HMPV infections, individuals can take the same precautionary measures they would for other respiratory viruses. HMPV is a respiratory infection spread in the same way as other respiratory viruses like flu and COVID-19, Easton said. We can protect ourselves against HMPV in the same way that we do for those viruses. The CDC recommends the following. Regularly wash hands with soap and water for at least 20 seconds. Avoid touching eyes, nose and mouth with unwashed hands. Avoid close contact with people who are unwell. Cover your mouth when coughing and sneezing. Stay at home when sick. HMPV is among the viral illnesses that the US CDC monitors continually, so any uptick in infection would become apparent very quickly. China steps up monitoring of emerging respiratory diseases. China's Diseases Control Authority said on Friday that it was piloting a monitoring system for pneumonia of unknown origin, with cases of some respiratory diseases expected to rise through the winter. The move to establish a dedicated system is aimed at helping authorities set up protocols to handle unknown pathogens, in contrast to the lower level of preparedness 5 years ago when the novel coronavirus that causes COVID-19 first emerged. The National Disease Control and Prevention Administration will establish a procedure for laboratories to report and for disease control and prevention agencies to verify and handle cases, state broadcaster CCTV reported, quoting an administration official at a news conference. Data for acute respiratory diseases showed an uptrend in overall infections in the week of December 16 to 22, according to an official statement released on Thursday. China is likely to be affected by various respiratory infectious diseases in winter and spring, Can Biao, another official, said at the news conference. He said without elaborating that the overall number of cases this year would be smaller than last year. Recent cases detected include pathogens such as the rhinovirus and human metapneumovirus, with cases of the human metapneumovirus among people under the age of 14 showing an upward trend, especially in northern provinces. In a recent interview with the state-backed National Business Daily, a respiratory expert at a Shanghai hospital warned the public against blindly using antiviral drugs to fight human metapneumovirus, for which there is no vaccine, but whose symptoms resemble those of a cold.